Hello, hi, welcome to the live session with Damansara Medical Center. So today we are bringing you our physiotherapists to talk on the breathing exercise for post-COVID recovery. So we have here today Miss Shamin Nisha. She's a member of Malaysian Physiotherapists Association. She herself is a physiotherapist in Damansara Medical Center. So Shamin began her career as a physiotherapist in Damansara in the year of 2012, and she is one of the senior physiotherapists in ADMC, as she was the very first few who started working in this organization since the opening of the hospital. Shamin graduated in 2011 from Masa University College, and throughout her 9 years of working experience, she has treated various conditions and is currently focused on cardiopulmonary rehabilitation with special interest in post-COVID recovery. So, hi Shamin, welcome.
Hi everyone. Good afternoon.
Okay, Shamin, a quick check. The topic of today's session looks quite interesting, very exciting. You may want to start up with the introduction and what is it all about? What are we going to do today?
Problem. So today we're actually going to just brief into breathing easy or breathe correctly. So to help to improve the breathing techniques as well. Yeah, so as we start, okay, what we're going to do today is I'm going to explain on how you're going to breathe correctly, how to relax yourself, right? So do join us in our live breathing exercise session, yeah?
Okay, Shamin. So without further ado, shall we begin with the exercise and let's just get on it.
Okay, all right. So in conjunction with the World Physiotherapy Day, we want to help you to add more lives to your years. So in view of the current COVID situation around the world right now, the much needed rehab program would be the post-COVID rehabilitation. But remember, prevention is better than cure, and it doesn't hurt to have a healthy lung. So let us help you to take care of yourself and your loved ones. If you have any questions pertaining to today's topic, please feel free to email to us, or you can write us in our chat box below. Okay, so as we all know, the COVID-19 outbreak had begun in China, causes mild to severe respiratory illnesses, including death. COVID-19 has since spread tremendously and is declared pandemic worldwide. COVID-19 has been categorized into 5 different categories, which include Category 1, with no symptoms, Category 2, with mild symptoms, such as fever, dry cough, fatigue, loss of taste and smell, sore throat, running nose, nausea, vomiting, or even diarrhea. Category 3 presents with pneumonia. As for Category 4, it presents with pneumonia and requires oxygen support. And last but not least is Category 5, those who are critical and require assisted ventilator. COVID-19 may cause a significant damage to the lungs, and scarring of the lungs are not reversible. So recovering the lung function is possible, but it can require therapy and exercises for months after the infection is being treated. So working towards recovery starts very simple, with the focus on breathing. Why breathing exercise is important to all of us? Breathing may be a natural body function, but many of us had taken for granted the power that breath has over our entire body. From the nervous system and the cardiovascular system, right down to your body individual cells, deep breathing has the ability to transform and renew your health. Did you know that the simple act of breathing properly is a terrific way of strengthening your immune defenses? Breathing exercise can help reduce your stress, makes you feel calmer, and makes you more energized. Breathing affects your whole body from the inside out. The truth is, most of us do not breathe correctly. Regardless where you're starting out, you can learn to breathe better. Here are some techniques and tips that we recommend exploring in your journey towards a healthier breathing. But before that, let's go over what poor breathing looks like. Poor breathing is a short, shallow breath high up in the chest, which looks like this. Therefore, deep breathing can help restore the diaphragm function and increase your lung capacity. It makes you have the better control of your breath. Anyone can benefit from breathing techniques, but they play an especially important role in the COVID-19 recovery process. We all have to start somewhere, right? So why not start now? This will allow you to breathe easier, improve your lung health, and it carries a long-term effect in regards to many different benefits. These exercises can be done at home and it's easily incorporated into your daily routine. But there are precaution measures that needs to be taken in order for you to start these exercises at home. Firstly, do not begin your exercises if you have fever, shortness of breath, or difficulty breathing while you're resting, chest pain, or palpitation. Okay, and please make sure you stop your exercises immediately if you develop dizziness, shortness of breath more than normal, chest pain, excessive fatigue, irregular heart rate, or any other symptoms that you yourself may consider an emergency. But important note needs to be taken for those who have any other underlying medical history. Please do consult your healthcare professional before you begin the exercises. So now, let us start our exercise. All we need is a steady chair, okay? And make sure, these exercises will tend to help you relax and correct your way of breathing. It induces your relaxation. So sit upright, make sure your back is properly supported. Your shoulders should be relaxed. Place your right hand above your belly button. Now, I need you to breathe in through your nose. Feel your stomach raise against your hand. Slowly exhale. I'm going to show you again. So breathe in through your nose. Raise your stomach against your hand. And exhale. And we're going to repeat it for 5 times. So breathe in through your nose. And exhale. Breathe in and out. In and out. Breathe in and out. One more time, breathe in and out. The next exercise, you're going to breathe in through your nose, but you're going to slowly blow out through your mouth with your lips together as if you're trying to blow a candle. So you're supposed to purse your lips and blow out slowly. Okay, I'm going to show you again. So breathe in, raise your stomach against your hand, blow out through your pursed lips. Remember, as you blow out, your exhalation should be twice of your inhalation. So breathe in through your nose, blow out through your mouth. Breathe in. And blow out. Breathe in and out. Breathe in through your nose and blow out through your mouth. One last one. Breathe in through your nose and out through your mouth. This next exercise will help to enhance your breathing control. Relax your shoulders. I need you to breathe normally a few times and relax. So after a relaxed exhale, use your index finger and your thumb to plug your nose. So breathe in and relax. Plug your nose for 5 seconds. 1, 2, 3, 4, 5. And breathe normally. One more time. 1, 2, 3, 4, 5. And breathe normally. One more time, plug your nose. 1, 2, 3, 4, 5. And breathe normally. The next one, we have to try to hold for 8 seconds. So breathe in only, exhale, plug. 1, 2, 3, 4, 5, 6, 7, 8. Breathe normally. And plug. 1, 2, 3, 4, 5, 6, 7, 8. And relax. Now, the next exercise is to expand your thoracic. So what you have to do, we incorporate with your hands movement. The first one is to bring your hands forward while you inhale. Okay, and next when you exhale, you bring your hands down. I'm going to show you again. So breathe into your nose. And exhale through your mouth. And we're going to do it for 5 times. So we're going to breathe in through your nose and blow out through your mouth. Gonna breathe in. And blow out slowly. Gonna breathe in. I'm gonna blow out. Two more times, breathe in. And out. One more time, breathe in. And out. The next one is you're gonna bring your hand sideways. Breathe in and blow out. Breathe in and blow out. In and out. Breathe in and out. One more time, breathe in and blow out. The next exercise is bringing your right hand, stretch it out over your arm, over your head that way, and blow out. You're gonna do it again for 5 times, so breathe in and blow out. Breathe in and blow out. Breathe in and blow out. Two more times, so breathe in blow out slowly through your mouth. One more time, last one. Breathe in through your nose. And blow out slowly through your mouth. Okay, now with your left hand. So breathe in through your nose. And blow out. Breathe in through your nose. And blow out through your mouth. Breathe in through your nose. And blow out through your mouth. Two more times, so breathe into your nose. And out through your mouth. One last exercise, one more time, breathe in And blow out. These exercises are basic exercises that can be performed by every individual. So before we end today's session, I will answer a few questions from the chat box.
Perfect, Shamin. I'm telling you, the exercises were so simple and so nice. Okay, so yes, guess what? We have collected some questions since our live session. So the very first question: how long must I do this exercise at home?
So you can actually do these exercises about 10 to 20 minutes in one session, and you can do it 2 to 3 times a day actually, yeah? So this is the best duration that you can do it at home.
I see. And the next question I have here: will I be able to recover fully if I follow these steps?
So recover fully is actually very vague and broad actually. So it is very much dependent on the patient goal itself and the idea of what recover fully means. So for this question, maybe we can provide you with a better answer if you can come to our rehab department in Damansara Medical Center, so that we can conduct an individualized assessment, and the treatment is based on your symptoms accordingly actually. Yeah.
Okay, you know what? To this question, there is a follow-up question. How long must I do this exercise at home? I mean, what is the duration of performing this particular exercise if they want to recover their breathing? How long they need to do this exercise?
Okay. If let's say you're doing it at home, okay, you just do it for 10 to 20 minutes per session, and you can repeat it for 2 to 3 times a day. So
yeah, but then for how long? Is it like during the 14 days of the quarantine period, or 21 days, or for a month? You know, roughly how long do they need to perform this exercise?
Okay, so these exercises actually you can make it as your daily routine. So you can do it every day. It's possible, it's fine, it's safe for everyone to do it at home. But just make sure those precaution measures are being taken at home, especially. Yeah.
Perfect. So that means we can make this as a routine, actually.
Yes.
That's nice. I should follow that. Really,
yes.
Don't you? Okay. So I have a next question. Can I lie down? Can I lie down and do this exercise? Yeah, it's actually an interesting question. You know, normally when we are tired after work, we got back home. So, you know, whatever we want to do, we want to just get it done on the bed. So, you know, can they do that? Can this exercise be performed?
Okay, actually, what is important is for you to be in the most comfortable position. So if you're lying down and that makes you very comfortable, go ahead. You can begin in the position, so from lying down position, and then you can progress to maybe sitting down later on. But start off with the most comfortable position that you yourself will feel safe with or comfortable with. Yeah.
All right. Okay, that's nice. So yeah, definitely trying it. So I have one more question here. Can I wear a mask while doing this exercise? It's actually a good question, since you have highlighted to do this exercise like 2 to 3 times a day. So yeah, you know, when we are working in public, so is it possible to wear a mask and perform this exercise?
Okay, if you're at home and you're in a safe environment, you don't have to wear a mask. You don't need to wear a mask because you're in your safe environment. But if let's say you're doing it in public, then you have to put on your mask to be on safer side. Yeah. So because as mask may reduce the ability to breathe comfortably. So like what I said just now, if let's say you want to remove your mask, make sure you're in a safe environment. So it's fine. Yeah.
I see. So I have a last question here before we end our session. So can a non-COVID person do this exercise? Yeah, it's an interesting question actually. Yeah, you know, we were talking about it, and you know, without even knowing if we can perform this or not. Those who are like, you know, not infected and stuff.
Okay. So yes, everyone can do this exercise. It is safe for everyone to do it, like what I've mentioned in the beginning just now. Prevention is better than cure. Okay, so everyone can do it, and please do it as a daily routine. So I would advise you to actually start today, and keep on doing it every single day. Yeah.
Okay, you know what? There are interesting questions from the floor. Okay, so one of the questions from Wani. Wani was asking, can breathing exercises improve the outcome in mild to moderate cases of COVID-19?
Yes, it can.
Shami,
It
can
can.
you hear me?
Sorry?
Can you hear me?
Can.
Yeah.
So yes, we can reduce. Yeah, it makes you much better actually. Yeah, so it's, let's say you continue or you start doing now exercises. Yeah, so you can keep on. You can make it as a daily routine and do it from now itself, and you can see the improvement day by day. So you go on your most comfortable phase. Like just now, like what I did was seconds of hold, depending on how comfortable you are actually. So you start off slow and you develop or you increase slowly. Okay? Yeah.
Okay. Nice. Okay, so the last question from the ground. Okay, it's from Wani as well. Should we start it from the very first day or after subsiding acute symptoms?
Okay. Acute symptoms actually depends on how you feel. If you are comfortable to start, okay, and remember, take in your precaution measures. If you don't have the precaution measures I mentioned just now, then you can start slowly. Okay, if you are COVID patients at home, I think you have your oximeter as well. So you put your oximeter, like the precaution measures that we mentioned just now. Make sure you don't have the leads in there, then it's fine. It's safe to do it. Yeah, and then you can, yeah. So you can as you're doing it, make sure you have the precaution measure in mind, and you have to stop your exercises immediately if you have developed any of the symptoms.
Perfect.
And if there's any emergency that you yourself may consider it, please do come to the hospital or straight away come to the hospital for assessment as well. If let's say, because what we do is any other symptom which is pertaining to that condition, is better to come and see us. We will assess you and we will give you individualized exercises accordingly. So it's safer that.
That is nice.
Yeah.
That's nice. That's nice. So, which means it's a customized rehab session for each patient based on their condition. That's nice. Okay, but you know what, Shamin, we have actually come to the end of our session. Due to time constraint, we may actually pull up another session on rehab exercise. Never know, very soon. So, thank you for joining us, and we shall stop here and definitely go with the second session soon.
Can, sure. Take care so
Alright.
much. Thank you for joining me.
Thank you,
Have a pleasant
Shamin.
day.
Thank you. Thank you. Alright, so we have come to the end of our session. Thank you for joining our Damansara Medical Center live session. Do join us for our upcoming next live sessions. Thank you.